Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, tomorrow starts our free 5th annual Truth About Weight Loss Summit, a 9-day experience where we have 40 amazing experts, doctors, clinicians, even success stories that are going to talk about the truth about weight loss. Somebody new to the summit this year is named Dr. Paule Joseph. She works at the NIH, and she gave such a fabulous presentation for the summit. I said, can you please come on my live show? And so in order to just kind of kick off the summit tomorrow, we have her here live today. And she's going to be doing a talk on how COVID-19 impacts the sense of taste and smell and what the implications of nutrition are. Please welcome Dr. Paule to the show. Nice to see you again.
Nice to see you, Chef AJ. Thank you so much for the invitation and to be here again and talk to the audience. I'm very excited about this.
Well, I can't wait. So, I think everybody knows the NIH and what it is, but just in case they don't, what is the NIH where you work?
So I work at the National Institute of Health, and the National Institute of Health has 27 institutes and centers, and I work specifically at the National Institute on Alcohol Abuse and Alcoholism, and we are the premier scientific enterprise, like the place in the country and in the world where we do scientific research about a number of different topics. So today I'll get to talk to you about one of those topics.
Well, I can't wait. I love your presentations.
Thank you. So I'll get started.
Sure.
Now, can everyone see my slides? No problem.
They look perfect.
Oh, fantastic. So, as Chef AJ mentioned, I'll be talking about COVID-19 and the impact that it has in the sense of taste and smell, and some of the implications that this might have for nutrition. Let me just move this thing over to the next slide. Can you still see the cameras?
I just see your full slide, your first slide.
Okay, perfect. I just wanted to make sure that we were not showing. So, and I thought of this particular topic for a number of reasons. I think over the last 2.5 years, we have heard a lot about COVID, and there has been this emergence of people just really discovering the sense of taste and smell, senses that often people don't think much about. So, it's really fascinating because one of the things that I often ask is, why is coffee a morning necessity for some people, but entirely too bitter for others? And what makes roses smells lovely to some while others can smell nothing at all? And these are basic questions that really helps us experience our environment. And as humans, we perceive tastes and smells very differently. And to understand those differences, the differences that exist, we need to understand the science behind them. And this is a really important time in history for us to really move forward this particular area. Let me just move my next slide. I apologize about this. So I have no financial disclosures at this time. The content that I'll be presenting is full responsibility of the authors and does not necessarily represent the official views of the National Institute of Health. So one question is, what determines our food choices and how our senses affect what we eat? So if we start thinking about the different things that may affect our food choices, we know that we have, for example, personal determinants like motivation, knowledge about foods, practices, different practices that we might have about food, as well as our social networks, and how different beliefs and attitudes that we might have as individuals. We also have different experiences with food, and these might also impact our food choices. But one particular one that I wanted to highlight are these biological predispositions that we have. So taste, pleasure, hunger, fullness, and here we have sweet, sour, salt, bitterness, and umami, which are our regular tastings that we normally think about. Also sensory specific satiety and genetics. And all of these different things affect our preferences and dislikes for different types of food, and really ultimately affect our food choices. So when we think about the senses in particular, we start thinking about how they not only impact the food choices that we have, but how they all come together to really help us have reward towards certain foods that we actually like to eat. So in this particular picture, just really highlight some of the things that I mentioned before in terms of like motivation, food consumption, sensory specific satiety, but really highlighting the olfactory system as well as the taste buds and how they are related to this area in the brains that are actually leading us to have more reward towards the things that we like to eat. So if I ask you what was the last thing that you smelled today, most of you may not necessarily remember, or what was the last thing that you tasted before you joined this life. If you love to cook or cooking, it's part of what you do, like Chef AJ. You can't imagine not tasting or smelling. But imagine for a moment in your life without the ability to taste or smell. So for example, many patients undergoing chemotherapy, this is an everyday, or this happens to them, and they might experience these symptoms in a continuous basis. And for others, probably did not experience this until COVID. And for many, probably still experiencing some of these things with long COVID symptoms. And we'll talk more about this in the future slides. So these can lead to a number of other issues like depression, and as well affecting the nutritional intake. So just putting more context into this idea of a world with no taste and smell. So these might come as a surprise to many, but the man responsible for setting your ice cream bar so high is none other than Ben Cohen. The co-founder is Ben and Jerry, who was born without the ability to smell. So this is what we call anosmia, that has severely limited his sense of taste and smell. So as a result, almost all of his enjoyment of food derives from its texture. So if you see this particular ice cream, it has a lot of chunks in it. And that is actually purposeful, because it's in a way that it can actually help you enjoy the food differently. So this has really been in a benefit to Ben and Jerry's. But I thought of bringing this example as someone that you might think about next time you go to the groceries and say, oh, this somebody that has anosmia. So when we talk about the senses, we all know we have these 5 senses, and sensory perception begins before birth and enables us to interpret the biological references of stimuli in our environment. So in early life, the senses play a crucial role in informing acceptance and rejections of foods and beverages. And these food preferences develop when they experience based on associations that are formed between foods and flavor and the consequences of this consumption. So we know that we have this basic, the 5 basic human senses, as I highlighted here on the screen. And the COVID-19 pandemic has had an enormous impact on people all over the world in a variety of ways. And one of these unique impacts has been the loss of taste and smell for many individuals diagnosed with COVID-19. So unlike hearing, vision, and touch, one of the things that we realize is that taste and smell are not routinely assessed clinically. So for the most part, patients tend to report dysfunction when there are pronounced effects in their quality of life. So if I ask you, when was the last time your doctor measured your sense of taste and smell, you probably won't be able to respond to me, but there's a reason behind that. So we really have limited number of guidelines that that can actually guide clinicians into what to do in terms of getting normative data that can help individuals know where they stand in terms of the sense of taste and smell, which is very different when, as I said, when hearing and vision, or even pain, because you know that if you go to a doctor, they'll ask you, you have pain from 0 to 10, and they have a scale to measure that. So, but this hopefully will be changing in the next couple of years as there's more advocacy towards this. And as I'll show you in the next few slides, as to why understanding where you stand when taste and smell is really important. And the other thing that is important to highlight is actually flavor. So one of the things that we know is that many individuals confuse taste for flavor. So many of the things that you might be experiencing when you are eating a particular food is actually experiencing the flavor that it has. So flavor has a component, as you can see here in this slide, of smell, taste, touch, hearing, sight. So all of these senses kind of come together to be able to help us have this multisensory perception when it comes to food. Taste in particular, and this is to highlight how important this is. And again, I just explained to you that it might be flavor that is being rated, but it has been the drivers of purchase decisions for at least the last 10 years. And we can see here that even during the pandemic in 2020, taste has remained, as I say, the king of the driver of purchases. So you want to get things that you like and that taste good. And that makes a lot of sense. So, but you know, what happens that when our senses are impacted, when we have these losses in terms of taste and smell, and I'll give you more context in the next few slides. But you know, there's often individuals experience a lack of appetite, development of different food aversions, more sensitivity towards food textures, a decreased enjoyment of eating, as well as, you know, decreased sensitivity to salt, sugars, and spices, and the ability to detect rotting food, leading to increased foodborne illnesses. So you can start thinking about the importance of this when it comes to food safety. So I won't go too much into the biology, but I thought that it would be important just to show you a little bit of this slide. So one of the things that we know is that our sensory system for taste in particular is remarkably sensitive. Not only we can detect substances at extremely low concentrations, but we're also able to differentiate between molecular compounds that are closely related. And in the tongue, we have these little, like these little buds that, you know, taste buds that we have here. And these taste buds are this onion-shaped structure, as you see here. And these have what we call taste receptors. And these are found in aggregates of 50 to 100 taste receptor cells in humans. Humans have an average of about 5,000 to 10,000 taste buds, and they can found in aggregates of 50 to 100 taste receptor cells. So, and this is important just to have in concept of what it looks like. And many individuals have had an experiment probably in school where they actually have like a blue dye in their tongue and they can see their little taste buds. So if you even look in the mirror now, you can probably see those little race bumps. And also, like, an important thing to know, and many of us have probably seen this picture at least once in our lifetime, where there's this idea we can only taste things in different areas of the tongue, but in reality, we can actually taste these particular substances across our whole entire tongue. And so that's always like to put this here. And also, you know, I mentioned taste receptors, and these are very specific. They're very specific, as we can see here, whether it's for umami, and you can think of umami as like, an example would be like soy sauce has that little savory taste. You know, sweet, as you will see, they have very specific receptors, as well as bitter, sodium, sour, and even fat. So fat has been considered like the sixth taste modality. And there's a lot of work that's being done currently in really trying to figure out what are these specific receptors associated when fat taste. And there's quite a bit of work being done in my lab and other labs across the country really to understand more about this. So like taste, we have the olfactory system. which is remarkably complex. There are over 400 olfactory receptors activated by a range of different odorants, and other molecules can reach the olfactory system either via the nose, which is right here, as we call orthonasal olfaction, or we can also do it through the back of the mouth as retronasal olfaction. So if you ever had some food, block your nose, release your nose, and now you're able to perceive that flavor, that's really what we're talking about in terms of that retronasal olfaction being activated. So what contributes to taste loss and alterations? So infectious diseases, as you probably guessed, as we'll hear more in terms of viruses, like COVID and other infectious diseases. Many neurological diseases, also individuals present with alterations in their sense of taste and smell. Several psychiatric conditions. For example, in Parkinson's disease, we know that individuals tend to lose their sense of smell at least 10 years before they have any motor neuron symptoms before that. So that can also be like an early marker of disease. And many drugs, as we can see, even for COVID, with Paxlovid, many individuals will complain that the medication tastes metallic. So many drugs might alter our perception of taste. So each of these conditions actually have a particular name. I mentioned anosmia, which is the inability to detect odors, but we also have hyposmia, which is the reduced ability. And later on, you'll hear me talk about parosmia, which is this distorted perception of smell that is triggered by another common odor. And I'll give you more examples about this. And for taste, we could have dysgeusia, which is distorted taste, usually unpleasant, which is what we are seeing when, for example, with many of the drugs that individuals might take. But also we have ageusia, which is the inability for people to taste at all. So you might be asking yourself, how do we actually measure our taste of smell and taste? So there's a number of measures that currently exist. Some of them take a little bit more time than others, but these are, for example, the ones that we use in our lab, where it helps us determine an individual's ability to identify smells, their threshold towards certain smells. And, you know, we have, in terms of taste, we have whole mouth tests, which this means that individuals will taste something and they will spit it, and then we'll ask them a number of questions. But we also able to do studies using neuroimaging, really to understand how for example, there's different reactions that might be occurring in the brain after a particular taste. And I don't have much of those studies here, but there's a number of groups that are actually doing this type of work. This is the newer smell testing kit that we actually use in the lab, but this was developed as a consequence of COVID, and it's one that is very simple, that really just asks individuals to rate a particular odor, and just really easy, that could be used in any location in a clinic very easily. So it's easily done. And again, just a few more pictures just to show you how this is done. So when it comes to smell, taste, and health, I always like to think that we've never been so close before. And, you know, there's no surprise here that, you know, COVID has affected us greatly. And this is data that I just pulled today as for this presentation in terms of the number of cases and death and recovery, and the estimated potential of long COVID cases that might be occurring across the globe. So this is the world meter for COVID. So it was at the beginning, it was a major mystery on how the virus affects the sense of smell and taste. You know, as of today, I showed you the data. There's been a number of individuals that have been affected by this disease. And in the last 2.5 years, a significant numbers of patients, when confirmed COVID-19 infection, reported anosmia and hyposmia, as well as dysgeusia. And these has been previously described in other coronaviruses, but these were thought to affect just 10 to 15% of cases. Yet this number at least doubled with this current pandemic. And in most reports, it reaches peaks about 85% among COVID positive patients. So these numbers can vastly increase the rates of post-viral anosmia, already a leading cause of smell loss in adults. And this is just to show you like the preference. And this is a map that I took from an article that was published in 2020. And this has since spread even bigger, but we can see how the concentrations of a lot of these cases across the globe. So COVID has now acted as a target to study smell, taste, and human health. So when it comes to understanding what is happening to us, how is this virus affecting us? There has been significant progress that have been made to begin to sort of elucidate the cellular and molecular mechanisms of how coronavirus is impacting anosmia. And most of the recent work has provided new insights into the cell types in the olfactory epithelium that express these relevant virus entry proteins. So you can imagine, for example, you have an automolecule, if you have a virus entering the nasal cavity, it has contact with the respiratory epithelium, the olfactory epithelium, as well as the olfactory bulb. And along this path, many are the cells that are vulnerable to the SARS-CoV-2 because they express specific proteins that the virus attaches to. And since then, what we have learned is that the supporting cells in the nasal cavity is what is being affected and have impaired functioning of the olfactory neurons, but these therefore causing a disorder. And there has been even a newer paper than the one that we had published earlier, confirming that these supporting cells are affected and that the main target cell type for the SARS-CoV-2 is in the respiratory mucosa. And there's no evidence of infection on the olfactory sensory neurons or the olfactory bulb parenchyma. And again, I won't go through all of these detailed pictures, but it's pretty much just showing in a photo just some of the areas that are being affected, that disrupted in turn by the virus. But also besides that, we know that that there's been this whole role of inflammation. So as the virus is entering, it's also disrupting the immune system, creating an inflammatory cascade that is also affecting the taste and smell, cells. So there's a bit of a component here that is going on in terms of the biology. So what is happening to taste? So there's a lot less work that has been done on taste. This is work that has been done by one of my colleagues here at the NIH, where also they saw that they have that this particular protein that we call the ACE2 that is expressed on taste receptor cells, and this might be the mode of entry of the virus into the taste cavity. This is a study that really showed that taste alterations are occurring in these individuals at a greater rate, and these were done in a clinical population, and where we had some nasopharyngeal samples as well as saliva samples. And this was also done by another of my colleagues here at the NIH. So these is examples that I wanted to share with you in terms of like some of the reports people were having. And maybe some of you have experienced this, so it might just not be a surprise. But for example, like things smell and taste as they were forgotten in the fridge. Fruit smells to me like NyQuil. I can only imagine how horrible that is. But I also took this particular tweet from an individual that said, I cannot smell the popcorn that is burning in the microwave, and the solution is that I can't taste it either. So you can see how this could actually have a safety implication, right? Like if you can smell something that is burning, maybe the house can go on fire and you might not smell something that is burning. This really tells us of the specific, how important these senses are, not for safety overall. I mentioned food safety, but safety overall as well. So these, as for good news, can be transient. So some individuals may recover, within just 5 to 10 days, while some individuals may actually take longer time to recover. And this is just an example I wanted to show with you in terms of a profile, like someone that had a mild case of COVID, no fever, no hospitalization, with history of influenza and pneumonia. And just interestingly, before they had their positive COVID test result, they had this strong content states of ketones and pennies. That was happening the prior week. And then they had a complete loss of taste and smell. Then they regained this by probably about day 8. However, they started experiencing phantom smells of cigarette smoke and coffee. And this lasted for about 25 days. And then it took about 5 months for them to recover. So it's very similar to the previous graph that I showed you. And again, often we want to be able to get objective measures, like I shared with you, and like the ones I'm sharing with you now. But what happened with the pandemic? We really had to think outside the box, because we couldn't really do a lot of these measures because it was a safety issue. So this really pushed us to really think on how to adapt to the reality that we were living in as scientists, but also do impactful work that we can actually understand what is going on with people, especially in their sense of taste and smell. So this led to really developing tools that can help us detect disease, monitor disease, and impact of disease on people's life. So I often like to think that the patients called, because a lot of these reports actually, as we saw, were happening in social media very rapidly, that really alerted a lot of researchers like me to really start asking this question: what is happening to people? As I mentioned, many individuals don't report taste and smell loss on a daily basis. So when we see that there's a large number of people reporting this, then we start raising our eyebrows and start saying, okay, what is going on? And this is exactly what happened. So then many of us got together and responded, and really that led to the development of the Global Consortium for Chemosensory Research that I'll tell you about. And this is a consortium that has over 700 scientists and patient advocates, all interested in this area of taste and smell. And we just really wanted to understand what were the taste and smell profiles of people with COVID-19. So that led us to develop a number of surveys that were deployed across the globe. And these happened in 36 different languages in one of the main surveys. And this led us to ask questions about, before, during, and after, what were the changes in taste, smell, chemostasis, as well as nasal blockage. And we really wanted to understand what were the similar and differences that we are seeing with COVID compared to other respiratory illnesses. So today I will show you some data that we collected from one of the tools that we developed that I just showed you, and where we really sought out to answer this question. So in our first published paper, we identified that COVID-19 was associated with severe impairment of smell, taste, and chemostasis. And this was actually one of the first papers to really show that this effect on chemostasis. And you might be asking what that is. So that could be like the burning of chili peppers, or like if you like cinnamon gum, and when you put the cinnamon gum in your mouth and you feel that burning sensation, that's what we refer to as chemostasis. So in our follow-up paper, we set out to understand whether and how chemosensory symptoms reported were specific to COVID-19 positive participants compared to participants that had other respiratory disorders. So we had a data set of about over 15,000 individuals, and we set out to answer the 3 questions. One that, can we show what we showed in the previous paper that I showed you, whether this was the severe loss was true through with smell, taste, and chemosynthesis in COVID-19. We also asked about differences in self-reports in individuals that had a positive or a negative result with a COVID PCR test and their COVID status. And we also asked about recovery. And, and one of the key things to keep in mind is that, everyone that responded to the survey decided to opt in. So this doesn't necessarily represent individuals that actually had anosmia prior to COVID. So what did we find? We saw, again, we were able to replicate our first results. When we asked participants to self-report in a scale of 0 to 100 about their smell function before and during the disease, as you can see, there was a significant smell loss in participants with COVID-19. And we can see that here when we look at the before and before COVID and the ratings during COVID. There was significant taste loss as when we compared the two groups as well. There was significant reduction in chemosynthesis that I just explained to you, and there was no differences in nasal obstruction or nasal blockage in this sample. So when we did this, we had about 70 questions that people answered, and we, with the idea in mind that we will identify the relevant information for quick screening. But if you pay close attention to this graph, you will see that the first set of predictors or the first set of responses here are all chemosensory variables, except fourth row. And then the other ones are changes in food flavors and chemosynthesis change. And this is particularly important. And we see that, for example, a binary question like we have here about asking about anosmia or hyposmia works well, but when we ask people to rate their smell in particular, we see that works even better. And, one of the things that we actually were able to discover was that, when we considered which is the overall best model to explain what we are seeing, we saw that the CDC triad of symptoms at the time, this was early in 2020, which was fever, coughs, and dyspnea, did not show a significant improvement from CHEMS, with an area here under the curve, as you can see, of 0.54. When we look at asking about smell alone, that outperformed the CDC triad by about 15%. So we had about a 70% chance that, that these individuals will have a true positive response when, diagnosis with COVID. And this, again, we can see that this gets even better when we add the rating of smell also, and looking at the days since they're reporting their smell loss. And, this was particularly interesting because we all came to the same consensus. This is a number of papers that really just showed that smell was an independent predictor of COVID-19. And likewise, we started looking at recoveries from smell loss in different groups. We've seen that it took about 40 days in general for people to recover completely. Just with the caveat that there's individuals that may not recover. So in average, it takes about 3 weeks for recovery. 80% will recover by 60 days. However, there's this 15 to 25% that I mentioned that show impairment even till today. So there's many individuals that have lost their sense of taste and smell early in 2020 that has not recovered it. And taste is reported to recover faster than smell. Why that is, we still don't know. And so we actually also looked at an Italian subsample. So if you all remember, Italy was greatly affected by this early in the pandemic. So we thought that looking at this Italian subsample, we can help us really understand a little bit more about recovery. And that was true, where we can see that, we have this group of individuals that will have substantial taste and smell loss across all three modalities that I shared with you. But what we see is that when we split this sample, we see that there's a group of individuals that, about 48% that partially recover, and we have about 51%, almost 52% that have substantial recovery. But one particular thing that was really interested is that we see that these individuals that have this recovery have this chemostasis actually is pretty intact. So they're able to have that that burning sensation. They can still actually feel that. And many of the individuals are actually younger but also report greater initial taste loss, which is actually interesting. You know, overall, we estimate, and this is again, not necessarily all with the data that I shared with you, that there will be about 10 million new people with taste and smell disorders. And that's actually a large number of individuals to experience this. So on a follow-up, we started, as you know, many individuals, as they've started to recover, they started actually complaining about having this parosmia and phantasmia. So if you remember, this is the distorted smell that I shared with you early slides. And phantasmia is actually like phantom smell. So like you smelling something that actually is not there. So this was actually a follow-up study where we had about 12,000 individuals. We actually ended up, after filtering, when about almost 1,500, and we divided them into those individuals that had a smell long hauler. So they still reported some decline on their sensory smell, and people that actually had recovered. And what we saw was that, you know, smell and taste improve over time, as I shared with you, but taste better than smell. But many of these individuals actually start developing, again, phantasmia and parosmia, and we can see that they're reporting this at a higher rate. We see that these individuals that continue to have this smell loss actually are sicker overall. They have more loss of appetite, fatigue, changes in smell and flavor, as we would expect, but also headache, as well as brain fog, hair loss. So many of these long COVID symptoms that individuals are experiencing even till today. So we know that you know, there's many factors that might be associated with this persistent smell and taste dysfunction, but we really don't understand what is the mechanisms that's leading to this. And many of these individuals are having great impacts in their ability to eat specific foods. And this is really important to really take all of this data into context and think about how this might be impacting our nutrition. Again, there's a number of symptoms that are associated with long COVID, and I'm not going to go through all of this, but I wanted to share this here. But you might be asking, but what about new variants? I got the last variant and I didn't have COVID. I didn't lose my sense of taste and smell. That you're probably right. So many, with the later variants, like with Omicron, there was less reports of taste and smell. Why that is, we're really trying to still understand a little bit more of this. So we really don't know why there's more reports with one particular variants of the virus and not the others. And we've seen that in the last few variants recently, there have been this resurgence of taste and smell loss again. So it seems like it's something that comes and go. And so we'll have to really do a lot of more work in understanding why. I just thought this was a very nice slide, just showing differences across Delta, Omicron, flu, and cold, just across different symptoms. So you might ask, what can I do to help fix this? In terms of management, we had limited treatments before COVID. So during COVID, they have been, a lot of the things that research was olfactory training. So often called olfactory rehab or olfactory therapy. So where individuals will smell certain, let's say, different things for a number of times a day and do this continuously, and just to see if they can recover their sense of smell. And there's been a number of clinical trials that have started really to understand the effects of this olfactory training and whether individuals can actually recover. And also there's newer treatment that is coming that are being studied just really to understand. And again, different individuals might take, you know, some of the other things that are listed on the slide, but with variability in terms of how effective they could be. In terms of resources for patients and for people, I wanted to really put this slide here, just in case any of you are really experiencing this. Where do you go? What are the questions you can ask? So at least you can see that you're not alone. There's a number of groups across, at least in the United States, we have the Smell Taste Association of North America, but we have other organizations worldwide that are actually focusing on this in helping people. So as I told you, we know there's lots of information in the media regarding how COVID has affected and impacted individuals' eating. A lot that came out last year in 2022, where people are really losing the joy in eating. And this has increased depression, anxiety in some individuals, as well as led them to have social isolation. A lot of the things that we do as individuals often revolve around food. Let's think about Thanksgiving. There's a lot of food on the table, but can you imagine if you cannot really eat it, taste, or smell it? So that's one of the things. I thought about sharing this particular story because I read this and actually was really pointing to me about the effect of this. So this particular chef, where in 2021, we had described losing the ability to taste and smell due to COVID, that really led him to just that left him completely lost. And these are just quotes that he had in the article. That steak tasted very metallic, like I had just licked the side of a car, and the cooked squash taste like rotting flesh. And then I picked up nothing from the rice, no garlic, no nothing. And this is Justin Burke. And he also said that at the point was so mentally and emotionally and physically exhausted, the case of COVID that I had, that I just broke down and started crying. So you can think of someone that really enjoys cooking, that they does this for a living, and just waking up one day and not being able to do this. But you can also think of examples of, for example, firefighters that actually need to have an instant taste, a preserved sense of smell, because it's critical that they actually can smell if something is going on. So we can think about this. This is another example of a different chef, Jackson Kalb, that also had to actually, I think if I recall correctly, the story had to actually close his restaurant, and also another one that had to close his restaurant because really just didn't have the ability to cook the same way anymore. So olfaction promotes a lot of well-being through nutrition and social behavior. And this, again, I'm hoping that I'm highlighting how important these senses are as we, especially for nutrition, to have our appetitive drive, have regulation in our food intake, many of the things that are important, but also protection for environmental hazards. There's many risk factors that can lead to malnutrition, especially when this COVID, where, as I shared with you in terms of like what the role that inflammation might have. But there's also a lot of distortion that I shared with you that individuals can have. And in this particular study, there was a lot of distortion in terms of specific foods, especially coffee, as we can see here. And we can see the different things that they actually ask individuals, and we can see how unpleasant people actually reported. So coffee and onions were actually quite unpleasant for many individuals. And I thought I had the citation here, but I'm happy to share that a little bit later. So there's a different paper that talks about dietary recommendation for patients that have post-COVID-19. And this is primarily highlighting, the importance of having a balanced diet, having more, like having a good hydration, as well as having what looks like more of a Mediterranean diet. Again, more recommendations in terms of dietary compounds that in patients with post-COVID syndrome, different things that can help in terms of like the immune system, reduce inflammation, and as well as stress. So in terms, I hope that I have been able to really highlight how important these senses are for nutrition. This is an example of a cookbook that was actually written by individuals that experiencing changes in taste and smell as a result of COVID. And it was inspired by that. I haven't really read it, so I can't say much to this, but I thought it was fascinating how, individuals got together just creating recipes and being creative in a way that can help them taste and experience flavor again, even when this conditioning. Here across the NIH, we're doing a number of studies just really to understand the impact, for example, of long COVID, the impact that, for example, alcohol, the COVID-19 had an impact of alcohol consumption, and how all of this might be impacting the sense of taste and smell as well. There's a number of questions that we actually need to continue to ask. So I hope that with this, I have showed you that, one of the things that I always think that has been the most positive coming from COVID has been the ability for us to work collaboratively as across the globe to really understand these issues, and just to be able to be in settings like this, to be able to share this type of work that and bring more awareness to these issues. With that, I would like to thank my wonderful lab who are just wonderful, but also a lot of the leadership team, the initial leadership team of the Global Consortium of Chemosensory Research. We all got together, worked countless nights and days, just trying to come up with a lot of these questions that I shared with you and doing the research, but also all participants across the globe that really answered a lot of these things that helped us, get answers in a timely fashion in the middle of the pandemic. And with that, I would like to say thank you and answer any questions that you have.
Oh, thank you, Dr. Joseph. I'm so excited for people to get to know you a little bit now, so that when you are speaking tomorrow in the Truth About Weight Loss Summit, they'll have a little flavor, pun intended, of what you talk about. And, it's really interesting about the chef, because I'm curious, you didn't cover this, but what effect does smoking have on taste and smell? And the reason I say that is, in my life, I've only met two chefs whose food I really didn't like, and they were both smokers. And I wonder if that actually impairs your ability to taste, because they put so much pepper in their food, because I'm wondering if they couldn't taste it because they were chain smokers.
Yeah, no, actually, there's lots of work on this, Chef AJ. Smoking does have an impact on our sense of taste and smell, especially for individuals that are chronic smokers. There's a number of studies on this. And also we're doing a lot of studies looking at alcohol. So for individuals that have alcohol use disorder, individuals that drink a lot of alcohol, we see those effects as well. So I cannot say specifically for those people. We will have to measure them, but that's an interesting observation.
That is very. I'm curious about the work you did at Monell Chemical Senses. That sounds like a really fascinating place to work.
Oh, yes. I trained at Monell. It's definitely the premier place in the world, really studying, taste and smell. And it was really a fascinating place to be there and to just really learn from experts in the field that are just fantastic. So a lot of what I learned there.
That is very cool. It would be fun. I would love to volunteer for some of these studies.
You're welcome. We're always looking for people.
Do you have to go to Philadelphia though for that?
You probably, or if not, you can come to DC.
Right. I went to college at Penn. I like Philadelphia. So TS, who's watching live, said, did they find that weight loss happened with the loss of taste and smell? When I had COVID, I lost my taste of smell, and I lost quite a bit of weight.
Yes. So that's a great question, Tia. And actually, you're absolutely right. So we see either that some people might lose weight, but we can also see the opposite. So, and it could be that, again, for a number of reasons, it could be that individuals that are losing weight, don't have that motivation to eat. As I shared, food doesn't taste the same, so why eat it? So you're not consuming the same amount of food that you were consuming before. But for other groups, what we see is that now, in an effort of getting food more flavorful, trying to perceive that, some individuals might add more salt and sugar to things, and it's like becomes a catch-22 because now they're trying to like make food differently. But I think you're not alone. There's been a number of individuals that have lost weight when losing their sense of taste and smell.
Well, how did the Ben & Jerry founder even know he didn't have a taste? I mean, like if he was born without it, like they don't test for that when an infant's born. How did they figure that out?
Yeah, that's a very interesting question, and I'm not entirely sure of all of the details on how he found out. I can't remember the exact story, but I'm pretty sure it was not until later in life. Many individuals that have congenital anosmia, it's like maybe when you're little and you're working with peers in school and they can taste something you can't, and they realize, oh, something's wrong. But I don't necessarily know his specific story. But I think it's one that is very interesting. It's someone, it's someone that most people know, at least know the company, but just an interesting fact.
Yeah. Well, when I couldn't smell, food really ceased to have enjoyment for me. I was only eating to survive. There was no pleasure in it when I couldn't smell it.
Exactly. And, and that's what I was trying to highlight throughout the presentation, in terms of like, how this is important for us to be able to also perceive, to have pleasure on what we are eating. Like when we go to a restaurant, we sit around the table, you want to be able to savor that, like eat that food and taste it and enjoy it. But as you said, many times you have to even mentally think about this and say, okay, I need to eat because I have to eat so I have nutrients and I can survive. But as you said, I hope you're better.
Oh, yeah, I was so thankful it didn't last very long. Because I was getting really thin, because it was like, I was just eating food because, you have to, but there really wasn't much pleasure, in it. So yeah. I just eat like white rice because it didn't matter what I ate. Everything tasted the same, That's
similar to the story that I just shared.
Absolutely. Yeah, that is just really fascinating, because when we think about like smells, like for example, you go to the airport, the Cinnabon, right? They use smells to kind of entice us to eat the food.
Yeah.
And smell is such an important precursor, I think, for a lot of people to appetite. Or think about going to a movie theater. I mean, they could sell anything. They could sell, I don't know, crackers, but popcorn, things that have really strong smells.
Yeah, and then you put some butter on that popcorn, and it's for some reason even smells more.
Yeah, absolutely. So one of the live viewers is Annette is saying, loss of smell has been shown to be a precursor of Parkinson's. Has loss of taste been shown to be a precursor to the disease as well? Or is that something that hasn't been studied?
No, it hasn't. That's a great question. And I'm great that you looked at that point. No, we haven't really looked into taste loss as a precursor of these other things. The one particular thing that I mentioned in one of my early slides was that, many neurological conditions might have these olfactory changes, and it could be like the proximity that it has to the brain, different areas of the brain, but not with taste. We haven't done much work with taste in particular. So there's a lot of room for us to do more work. As I shared, not only when these diseases and really understanding how these senses are changing when disease, but also as we understand this, to develop more novel treatments for people.
Yeah. Well, how they've talked, how some people, they call them super tasters.
Yes.
Are there people that are super sniffers or super smellers?
We think that, right? Like, I mean, there's individuals that say that they can smell wine very well, but there's also individuals that can say they can smell things from they have this very sensitive ability to smell different things. And I can always think about this, and this is anecdotal, not based on my work, but I always think about this even with my own sister. She can smell anything, like she's looking for that dead mouse in a room, and I'm like, I can smell it, but she can't, and then we actually find it. There's individuals like this that they can smell things from a mile away. And I think that's actually fascinating. And I often think about wine tasters that have this ability to distinguish the different things within, you know, in a particular cup of wine or glass of wine.
Well, I always think about like pets, like in dogs that sniff out cancer, like that. That's, I mean, imagine if we could do that, you know?
That would be amazing. And you know, and dogs have a refined ability to smell. And I remember, if I'm recalling correctly, a lot of that early work that was actually being done at Monell when I was there, in terms of like using dogs to smell diseases like cancer.
Yeah.
But we know that you know, dogs are used to smell even, you know, at an airport, to be able to identify certain things, how we can, and they get trained.
Yeah, or bombs, the bomb sniffing dogs, right?
Bomb sniffing, yeah.
Incredible, incredible. So Laura is asking, is there research suggesting that people's food preferences change if they lose their sense of smell, or are they more likely to have vitamin deficiencies?
Yes. So, I mean, so what happens is, like, a lot of, there's work that has been done showing that, you know, as individuals lose their sense of taste and smell, and they alter their eating habits, they're actually not consuming as more nutrients. So they can be losing a lot of, you know, a lot of intakes of vitamins. And there are vitamins that are also necessary to be able to sustain our taste buds in particular. So you can think how that is also affecting our ability to actually regenerate cells in you know, our taste receptor cells, that can influence taste, smell loss, or taste alterations that can lead us to not actually eat a nutritious food. And I hope that was actually clear. I was trying to make all of those links. Thanks, Laura, for your question.
And Susanna says, is there a difference between male and female senses of smells?
That I didn't add this in this presentation, but we have seen sex differences in, you know, smell identification tests, in smell threshold tests. And, you know, that's why I often like to say, you know, we all live in different sensory worlds, especially as male and females. So yeah, there are sex differences, and there's quite a number of studies showing that. And we can actually see even, for example, in pregnancy, how women during pregnancy have this sensitive, have developed sensitivity to smells as well. So there could be a lot of hormonal changes or differences hormonally that might be eliciting these changes as well.
Yeah, it's just, it's so interesting to me how certain smells can be pleasing to some people and noxious to others, you know?
Yeah, absolutely. Absolutely.
You know, like blue cheese, for example. Ugh.
Oh, nah.
Yeah, and
we're in the same camp here.
Yeah, that it's just so interesting to me that's like that. Is there any kind of protocols for people whose sense of smell, whether it's from COVID or other reasons, haven't returned? Any, like, is there any training or anything they can do to help facilitate the return of it?
Yeah, and I think that so I put it on one of my slides where I shared about olfactory training. You know, these are specific kits that individuals will get. Sometimes some individuals will, you know, get I'm even forgetting, like, these little things, and just smell it on. There's a specific protocol that in terms of how many times to smell it, for how long. And it's actually it's a commitment, because it's not that it's going to work by doing it every day for 1 week. Sometimes people have to do it for a couple of months to be able to see some changes. But that's been promising for some people to do.
I wonder if any of this is cultural, because, you know, like because certain foods, whether we like them or not, are cultural, certain tastes. And so I wonder if smells are the same.
Yeah, and yeah, no, and there's a cultural component to this. So actually, one of the tests that we use has to be adapted based on different cultures. So like what we will use for individuals here, we probably wouldn't be able to use it for individuals, for example, in another country, like in India or somewhere else. Because there are really differences on experiences that we have, and there's different adaptations as we get older as well. But that is a very important consideration.
Yeah. Well, tomorrow you're going to be talking about, let me pull it up, your topic tomorrow on the Truth About Weight Loss Summit. You're the 4th out of 5 speakers tomorrow, which means you'll probably come up around around 11 Pacific time. You're going to talk about taste and pleasure and how our senses influence what we eat.
Yes. So it's a little bit different. It's a lot different of a talk, but I'm very excited to be sharing about that and just really highlighting the importance that these senses have, and for people around the globe to really pay more attention to these particular senses. As I shared here today, and I'll be talking about tomorrow, it's very important for our nutritional intake and our food choices, and for us to experience the world. We need our senses.
Absolutely. How did Helen Keller do it, though? You wonder. And when you lose one sense for whatever reason, do other ones get stronger? I've heard that. I don't know if it's true. I used to volunteer at the Braille Institute, and that's what they said, but I don't know if that's true.
Yeah, and there's some work in really trying to understand a lot of what happens when someone loses a particular sense, and what happens to the other one, and whether there are changes that could be happening, especially if you lose your sense earlier in life versus later in life. All of these things might be playing a role. But I always think of Helen Keller as she had wonderful quotes in terms of like how sometimes we don't appreciate the role that these senses have until we lose it. And that, many times we just walk around the world without really paying attention and stopping to smell the roses.
Yeah, literally. Thank you. This was such a wonderful presentation. I'd love for you to, if you're able to, come back sometime and talk about the work you did with Kevin Holm, because that study is a lot on my channel by various doctors, and I think that would be fascinating.
Oh, absolutely. I'll be more than thrilled to share a lot about especially what we're doing now with processed and non-processed foods. We have a follow-up study, which probably will be coming up on your channel a lot more. Together with the first one. So yes, absolutely. That was a pleasure study to actually do.
Yeah, that's one of my favorite topics, because I'm just not a fan of processed food for children or other living things. So if anytime you have time in your schedule, please come back, Dr. Joseph, to talk about it.
Absolutely.
Oh, thank you so much. This was a wonderful presentation.
Thank you so much, Chef AJ. Thank you. And thank you everyone that has tuned in to listen as well. And if you have any questions, we're more than happy to help.
Thank you. And thanks all of you for watching another episode of Chef AJ Live. The show will air at 2 p.m. Pacific time live for the next 9 days in order to make room for 5 hours of programming every day for the Real Truth About Weight Loss Summit, airing free. So please register. Take care, everyone. And do stop and smell